Today we're going to be talking about how to choose the best hearing care provider for you. So maybe you're thinking about getting hearing aids, or you've already had a consultation and you want to shop around and see what other providers have got to offer. So in this video I'll be talking about how the things you should be looking out for when choosing a hearing care provider. So number one, and most important, is don't shop around for the best hearing aid technology at the lowest price. You're better off shopping around for the best audiologist you can get. And the reason I say this is because that is the most important component within the whole process of getting hearing aids. And it's the audiologist who's going to set the hearing aids, who's going to tune the hearing aids, who's going to make sure the hearing aids work for you and that they are the most appropriate hearing aids for you. So choose an audiologist who's knowledgeable, has got qualifications, experience, and probably most importantly, who you get on with. So somebody that you've got a rapport with, who's been listening to you, who understands your needs. This is by far more important than the level of technology that you're going to get or the make or manufacturer of the hearing aid. So that's my number one tip. Shop around for the best audiologist, not for the best hearing aid. Okay, number two, you've got to know who you're actually buying the hearing aid from. So do your research on the clinic where you're purchasing the hearing aids. So how long have they been going? Do they have a premises? Do they have a full-time premises? Or are they a one-man band, or somebody, a pop-up in the back of an optician's or a pharmacist? That's not necessarily bad, but just be aware you can't always guarantee that that person will be there in 1 year's time or 2 years' time or in 5 years' time. So you need to think how established the clinic is and what the likelihood is that they're going to be there in the next few years. Number three, how well equipped is the clinic? Do they have soundproof rooms? What are their procedures? Are they following audiologist best practices? Now, research has shown that by following audiologist best practices, such as performing hearing tests in soundproof rooms, doing real ear measurements when you fit the hearing aids, having follow-up appointments for rehabilitation and fine-tuning, all of these things end up with a much higher chance of a successful outcome than not doing those things. So you need to be sure that you are getting lengthy consultations, detailed consultations. The audiologist has all the necessary equipment, skills, knowledge to perform the audiologist's best practices. And that will determine what the level of the outcome is going to be.